Thank you for joining me today for another episode of Hunger Hunt Feast. Today, I want to touch on a couple studies looking at the effects of a hunter-gatherer diet or a low-carb ketogenic diet on the risk of atherosclerosis or heart disease, and then touch a little bit on the benefits to the immune system towards the end. But just in this effort of the last few weeks to really counter some of the misinformation that we're getting from our official, like the Nutrition Academy, our official sources telling us how we're supposed to eat and telling us that we're not following them. That's why we're all getting sicker and fatter, right? When you really look at the data, we are eating as a whole, as a country, eating more like, and I'm talking about the US here, and I think most Western countries would fall into this, Canada, probably Australia, much of Western Europe, are eating more like the food guidelines as set up by the USDA and the Nutrition Academy, which is less meat and more seed oil, more cooking oils, basically, not necessarily because we're cooking with them, but because they're in the processed food that we're eating, or they're substitutes for things, processed food, again, substituting sugar, oils, different grains for real food. And we're eating less meat and more of these processed foods and more grains and so forth. And yet we're getting fatter and sicker. We're following the guidelines. We're getting fatter and sicker, more diabetes increasing, obesity increasing, overweight population going up, more hypertension, and type 2 diabetes, of course, being one of the most expensive illnesses, really costly for the healthcare system, going up by 25% in cost every 5 years or so. That's quite an increase. So something about maybe what they're telling us might not be adding up, right? But yet there's still a lot of dogma against a low carb diet. Oh, it's a fad diet. Oh, you can't maintain it. You can't stick to it. Oh, there's a risk of heart disease. Oh, there's too much fat. Well, let's look at how we ate a little bit. One of these days looked at how we ate before, over the last 100 and 120 years, before we had the seed oils, before we had so much sugar in our diet and processed food, and what that looks like. It's really, I'm not going to dig into these studies too much. I'll give you some of the summaries, but because I don't want to get boring, but I'm going to link to them in the show notes. But basically, it was a paradoxical. It's called the paradoxical nature of hunter-gatherer diets, meat-based, okay, yet non-atherogenic, and it was like 65% of the calories came from meat sources, from animal sources. Excuse me, 25, 30. I think 19 to 35% came from protein, anywhere from 40 to 60%, 35 to 60% came from fat. Calories came from fat. And then, of course, the carbs were left anywhere from, depending on, they fluctuate from diet to diet, but about 25 to 40 came from carb sources, which is plants that they could gather. The rest is what they could hunt. So it's literally hunter-gatherer. They either gathered the plants, hunted the food, no atherogenic risk, no risk of heart disease in these populations, even in later years. There's another second study, impact of 2-year trial of nutritional ketosis. So they were watching a group follow nutritional ketosis for 2 years for risk of heart disease in patients that already had type 2 diabetes. So they're already metabolically unhealthy. They've already got an extreme metabolic disease, type 2 diabetes, thought to be irreversible by many, told by many in the health community, medical community, although we see it reversed all the time with ketogenic diet, intermittent fasting, low carb diet, right? Here's the conclusion. Consumption of a very low carbohydrate diet with nutritional ketosis for 2 years in patients with type 2 diabetes lowered levels of small LDL particles that are commonly increased in diabetic dyslipidemia and are a marker for heightened cardiovascular disease risk. A corresponding increase in concentrations of larger LDL particles was responsible for higher levels of plasma LDL cholesterol. the lack of increase in total LDL particles, ApoB particles, and in progression of the CIMT, which is basically, it's a scan of the carotid artery. Okay, so they did a scans of the carotid artery to see if there's plaque building up, providing supporting evidence that this dietary intervention did not adversely affect risk of cardiovascular disease. So to kind of explain that, because it sounded like a lot of words thrown together for a study, didn't it? They looked at the LDL concentration change over that 2-year period on this ketogenic diet, which is obviously more higher protein, lower carb, higher fat, right? And they found that while LDL number, so the LDL, your typical LDL number that you get in your blood test is called LDL-C. That's the mass or the weight of the LDL in your blood. They looked at that, which, yes, it went up, but there was not more LDL particles. In other words, not more individual LDL particles floating around. Now, why is that important? LDL is not all LDLs the same. There's small, you probably know, the small, dense LDL particles. Then there's these large, fluffy ones. And so then there's some oxidized LDL, which are also usually small and dense. Okay. So the large, fluffy LDL are not considered atherogenic because they don't get caught in the porous fissures and the porousness of the vascular system when there's inflammation or when there's a fight of bacteria, when the immune system's trying to, is putting these plaques in to reduce inflammation or affect, not reduce inflammation, but actually to respond to the inflammation to patch up the endothelial lining of the arteries. The small, dense ones are the ones that get caught in there when there's inflammation from, say, high blood sugar, high insulin levels, or a bacterial infection. And so the LDL, they mentioned ApoB. So you measure ApoB to find the number of total particles. The higher the particles, the higher your risk. Not so much moving away from looking at just the total weight, because that doesn't tell you what kind of LDL you have, what's your quality of LDL. Looking at a quality of LDL, the small dense particles or the oxidized particles tend to be the ones that get caught in, or the ones that get caught in the inflamed tissue. Okay. And those can normally, if there's no inflamed tissue, those flow right on by with no problems, generally speaking. But inflammation can allow them to get caught up either in the response of our immune system, the monocytes and the adipocytes attacking a bacteria that might be in your bloodstream, or when you have high blood sugar levels or high insulin levels, you have a lot of inflammation. Kind of think about a scrape on your arm. It's kind of sticky and the skin's kind of porous, right? So things can pass through it quickly. So that's what happens inside your veins. In the lining of your veins, they get porous and sticky. And so these little particles come through there. Now, oxidized LDL, believe it or not, isn't necessarily going to come from saturated fat, because saturated fat, as I've talked about before, saturated fat does not oxidize easily. It's saturated. There's no place for the oxygen to attach. Whereas unsaturated, like a polyunsaturated fat, has many openings where near these hydrogen molecule, where should be a hydrogen atom in that spot. It's open. So it allows oxygen to come in there and break off and create a place of where there's oxidation or rust or age to that fatty chain. That's what causes oxidation. That's coming from plant or seed, what we call seed oils. They're called vegetable oils to sell them to you, but they're really seed oils or grain oils. So soybean oil, corn oil, canola, safflower, all the ones they tell you are heart healthy, they really are easily oxidized, usually oxidized in the bottle from just their processing, because you've taken them out of the seed. Now, the polyunsaturated fats, if they're in a seed or they're in a nut or they're in, their natural form, they're not going to be oxidized because they're still in the original encasement, right, of the food. They haven't been extracted. Once they get extracted, they're very volatile and very subject to oxidation, especially if you cook with them. But even if they're just put in a processed food and sitting on or just in the bottle sitting on the shelf, they're going to oxidize very quickly. So that can create, those polyunsaturated fats can create oxidized LDL from our liver taking that fat and processing it into an LDL particle to send it out. So in form of triglycerides, whatever. Triglycerides are carried by LDL, okay? cholesterol is carried by LDL. All it needs is some oxidation. And those oxidized LDL often don't make it to the destination. So the LDL is carrying triglycerides or cholesterol needed to certain tissues. And they have these like little signal flags, let's say, on them, for use, lack of a better analogy, a little flag on them that the corresponding cell that's supposed to pick them up or take them would recognize that flag as for what it is. It's triglyceride or LDL. If they need it, they'll take it. And because LDL, it carries antioxidants, all sorts of fat soluble molecules that don't work well in the bloodstream because they're fat. They don't mix with water, right? Oil and water don't mix. So it has to be packaged in the LDL to carry these fat soluble nutrients, vitamin A, K, D, D. They're fat soluble. They have to be in fat, and they're wrapped by LDL, which is a protein. Okay. And so if that flag is damaged from oxidation, then sometimes it doesn't get picked up where it's supposed to go, the cell that needs it, and it stays in residence. It stays in your circulation longer than it normally would, or than a normal LDL, healthy LDL particle would. The small dense ones are just small. Usually they're full of triglycerides. So if you have a high triglycerides, high blood sugar, high triglycerides and low HDL and high, you're probably got more small dense ones, more small dense particles in your system, and rather than light fluffy ones, large fluffy ones. And so those are more likely to get caught in this activity. So that is what they looked at. And what happened was during this ketosis, time of ketosis, a study, there were more large fluffy ones, fewer small dense ones, and that would get caught in the particles. So they determined by that there was actually less risk for atherogenesis, and found supporting evidence by doing a CIMT, which is a scan. It's like an ultrasound of your carotid artery. So, which is a good indicator of whether you have maybe calcium building up anywhere else, like in your arteries and the rest of your body. So if you're not familiar with what causes heart disease, I might as well dig into that right now. So as I mentioned, the buildup of plaque is often caused by monocytes, which are basically immune cells, and these macrophages, which, if you ever seen an illustration of this with something that looks like a Pac-Man, how they illustrate it often, they're eating these bacteria, and there's a lot of inflammation caused not only by the bacteria, but by this attack from our immune system. Normal, right? It's like we get kind of puffy stuff. You scrape your arm, you get puffy, gets inflamed. Immune system comes, sends cells, white blood cells to patch things up and kill the bacteria so you don't get infections going through the rest of your body. Well, that's what happens here, except it's in the lining of your artery. And so they're attacking this bacteria. And as I mentioned before, inflammation is also caused by high blood sugar and high insulin levels in your system. So you have systemic inflammation. And so that's where those, in both cases, it makes a very porous, inflamed tissue lining for the LDL to get caught up in it. They're not really part of it. They're not really causing it. They're just kind of a bystander. And they're there doing their job because they're doing good stuff. They're part of our immune system, but they're part of delivering nutrients. But they get damaged, again, by sugar, seed oils. Sugar can also oxidize fats. It's called glycation. It can cause some oxidation there. And many of the bacteria, what about these bacteria? So many of the bacteria, you probably know that some of the bacteria that cause heart disease are actually come from our mouth. You've probably heard that before. That was something discovered a couple decades ago. But it's they can pass through, let's say, bleeding gums and get into our bloodstream, and then they get to the heart, and they can cause these problems with heart disease. Actually, I have a client who is very involved. He's a retired dentist. His name is Dr. Tom Neighbors, and he was very much a part of setting up labs to discover these bacteria that come from the mouth and can cause heart disease, and how to treat them. Discover them, find them in your mouth, test for them, and then treat them to lower the risk of heart disease from these oral bacteria. And he's still very involved in that, does talks on it, and hasn't created a network of dentists who who treat this. So it's funny little fact, 52% of the bacteria that cause heart disease actually come from your mouth, as opposed to coming through your skin or coming through some other orifice. Okay. They come through your mouth. So something worth looking into as far as getting yourself treated, looking for a dentist that treats that oral bacteria that can cause heart disease. So that's where the inflammation starts. The cholesterol is just a innocent bystander gets caught in the mix. They're already supposed to be there. That we need cholesterol, part of a healthy system. We couldn't live without it. But the hunter-gatherer and low-carb, even ketogenic diets, which have more fat in them, tend to lower your risk because of the quality of the cholesterol. And that means much more than the total mass or the LDL-C, which most people are still looking at, of your cholesterol. We have to look at particle numbers, other quality, triglyceride to HDL ratios, stuff like that. High triglycerides usually have some more small dents, as I mentioned. So now, high blood sugar and insulin do cause this inflammation, but it's usually a result of insulin resistance. That's why you have more blood sugar chronic. So not just after a meal, that's normal, but chronic, where it stays high, your insulin stays high all the time, hyperinsulinemia. And this often happens or begins with the liver taking on more fat, having to store more fat, because there's many cases, a lot of fructose coming to the liver. Fructose is only processed in the liver. Glucose is processed all over your body, your brain, your muscles. Only about 20% of it makes it to the liver, if that. Well, the majority of fructose goes to your liver. 90 to 100% of it goes to your liver to be processed. And there's a large, coming from processed foods, sodas, any just sugar, sweets, right? Goes right to the liver to be processed. It's more than it can handle. It can handle about 400 grams of glycogen. So the rest gets converted to fat. So we have fat building up the liver, and then the rest of the visceral area being your trunk, where all your organs are, right? So when this it starts to affect organ function. As you get the visceral fat building up in your system, you get it not just affects the liver, which causing some of that insulin resistance, pancreas, which causes insulin function, insulin communication with glucagon, and shutting that off when it's supposed to, or basically keeping a balance there. Kidney, so hypertension, heart disease affects the heart because you have all that building up. And as I mentioned, overall systemic inflammation. And this can really affect your immune system, as you would imagine, if you're systemically compromised, inflamed, or you have some organ function dysfunction from the visceral fat. So there's a couple of studies I'm just throwing in here. They'll be in the show notes. More visceral fat increases risk for COVID-19, ICU admission, and mechanical ventilation. And this just came out mid-January this year, 2021. Basically, they found that visceral fat was much more of a stronger association for intensive care with patients with COVID-19 than subcutaneous fat, or than the fat that we're all worried about because it makes us look, chunky in our jeans, or because, we're trying to get ready for the beach, we'll lose weight. So the fat under the skin is subcutaneous fat, right, around our body. But the visceral fat that's up under the muscle, in the trunk, around the organs, that's what's dangerous. That's what affects our immune system. That's what causes inflammation and all the organ dysfunction. So there's a much stronger risk for people with COVID-19 when they have a lot of visceral fat. They're much more likely to be taken to the ICU and need mechanical ventilation. The other study showed the same thing. Greater risk than subcutaneous fat. Visceral fat shows the strongest association with the need of intensive care in patients with COVID-19. So how do you get rid of visceral fat? Same way we get rid of most fats with diet, right? Start with diet. But the best strategy for reducing visceral fat specifically is dietary, not necessarily exercise. Specifically, intermittent fasting and low-carb diet. Surprise that I would say that, right? But it truly is. To get rid of that visceral fat and the fat around the liver, you can only reverse that. You can't reverse it with medication. You got to reverse it with diet first. allowing the body to burn fat, get out of its way, let insulin levels come down, let your liver burn off the fat, let the energy get low in the liver, so it needs to pull from that fat to replace this energy rather than you just put food in your mouth to replace it, especially fructose. So eliminating fructose, eliminating the seed oils, which cause inflammation, and really be eating, I would say, a high protein diet. I would say, the fat that naturally occurs is fine. Cut those carbs down because that's what's affecting blood sugar, and that's supposed to an energy, right? So you want to tap into your stored energy, not keep replacing it with energy, but keep the protein in there to keep your muscle mass, right? Lean mass is important, bone structure, bone mass, and help everything just function correctly because that's what we use for structure. But an animal-based diet, and this is the best strategy for reversing type 2 diabetes. This is what Jason Fung does: is fasting, low carb diet. Several clinics that reverse, been able to not only reverse obesity, weight gain, but type 2 diabetes. It's a low carb diet. Okay. You go to your hospital, you go to your typical nutritionist or dietitian, they're going to keep your carbs there and just dose your insulin for the amount of carbs for your 60%, 70% carb-based diet. Lower protein, low fats, right? Lots of polyunsaturated fats, more of those highly oxidized fats, and more carbs. And let's just dose your insulin. And you're not going to reverse diabetes, right? Not with them, you won't. So reverse your risk for diabetes, reverse your risk for cardiovascular disease, reverse your risk for COVID-19. Intermittent fasting, animal-based diet, higher protein, low carb, at least to get to your goal weight, and then you can kind of see what you can maintain. But while you're getting there, you're going to have to reverse things, right? If you already have visceral fat, if you're insulin resistant, need to have weight to lose, type 2 diabetic, you got to do a little more than you would to maintain. So it's not a balanced diet. Balanced diet's not going to work. You're out of balance already. If you want to get back in balance, you're going to have to go the other way, right? You got to push, you got to move something. You got to have enough force. You've got force moving in the direction of disease. You've got to change that direction. You got to move it back. You need a greater force to push it back, which means you have to do a little bit more than maybe you want to, or is comfortable, to turn that tide, to push it back. Okay. And then once you get to a maintainable spot where your weight's good, you're insulin sensitive, you can give a little bit, but by then your habits have changed. Start changing your habits. Protein-based diet. Okay. Animal-based diet. Meat, eggs, fish, ocean caught fatty fish like salmon, sardines, oysters, great. Get the EPA, DHA. The plant-based omega-3s really aren't sufficient. They're not going to give the EPA and DHA that you can't get that. That's an ALA. Not the same. It's inferior. So go for the EPA and DHA with the fatty fish. Ocean caught only. Farm raised is not going to have it because they're feeding it grain. And know that in eating an animal-based high protein diet that has some naturally occurring saturated fat in that meat, right, in those eggs, your cholesterol quality is going to be improved. It's going to improve your atherogenic risk. Your risk of heart disease goes down. You're going to start burning off visceral fat, lower your risk of diabetes, or reverse any kind of, if you're pre-diabetic, insulin resistant. So you will lose weight as well. And some form of intermittent fasting, or at least limit your meals to 3 meals a day, no snacks. And then if you can, find a couple of days where you do 2, lunch and dinner only, and really start allowing your body to tap into that stored fat. So links to these will be in the show notes. If you ever have questions, please reach out to me. I'm happy to answer them. But I hope, some of these studies are hard to read, but you can get the gist if you go the gist of it. If you go to the conclusion, kind of read what they found. And these are not people looking for, they're not necessarily low carb people. Okay. These are typical researchers, nutritionists. These were in endocrine magazines that goes to, these are published studies. They're clinical studies. They go out to doctors, Endocrine Today, Nature, Nutrients, that kind of, these are clinical nutrition. These are not observational studies. They took their cholesterol measurements over that 2-year period. They looked at the now the first one was technically would be an epidemiological study because they looked at the heart disease risk of these people who follow a plant-based diet. So that one is epidemiological, but it's not food frequency questionnaires which we're getting a lot of our official information from, where they're asking people what they ate over the last 4 years to remember it. And then they're grouping eating meat in with other bad habits like smoking and lack of exercise, alcohol consumption, poor sleep. And they just kind of lump them all in together. So they consider eating pizza, eating meat is the same as eating a steak. So it's kind of, there's a bias there. Really looking at a ketogenic diet, looking at a hunter-gatherer diet, not just a standard American diet and saying, oh, protein or fat is going to hurt you. Yeah, in that diet, everything, you don't know what's hurting you because you haven't really teased out every item. They're just looking for, oh, there's meat involved. Okay. When there's a lot of other factors, co-founders with that. So again, you've heard me rant before about the information coming out from our official sources. It's flawed. It's based on, really, in my opinion, money from sponsors from like Pepsi, ConAgra, General Mills, sponsoring our nutrition academy. That doesn't make sense to me. Processed food, sugary soda drink, companies sponsoring our nutrition academy. There's going to be a problem. There's going to be a problem. So, the people who did these studies, they're just typical researchers looking. You can tell by when you read through them. Some of them were shocked. They even tried to explain some of it away. Oh, maybe they ate more, like the hunter-gatherers, they ate more polyunsaturated fats. They ate more. Yeah, hunter-gatherers aren't eating polyunsaturated fats from cooking oils and processed food. They're not eating canola oil. They're eating polyunsaturated fats from some whole nuts or some fish that they caught. Not canola oil, soybean oil, corn oil, safflower oil that's in their processed food or that they're cooking with, because they're cooking with lard. If they're cooking with a fat, they're using lard or butter maybe, but they're probably not making butter. They're using lard from the animals they killed. So understand they're trying to explain it from their paradigm, which is saturated fat bad, but that's not what they're finding when they go through these studies. So even then, this is coming out when they really start looking at the quality of the cholesterol. The risk is actually diminished, as opposed to what you'll hear in the mainstream. The risk is diminished on this 2-year ketogenic diet. Talk to you later.